525 in health news this Monday morning. The American Academy of Pediatrics is suggesting the CDC's vaccine committee reevaluate rotavirus vaccination guidelines. The vaccine protects babies from the potentially serious disease, which can lead to diarrhea, vomiting, and stomach pain. Current guidelines recommend giving the vaccine after a baby has left the NICU. But a new study shows more than half of extremely premature babies aren't discharged until after 15 weeks. The AAP says this creates an unintentional barrier of care for the most vulnerable infants. Taking GLP-1 based medications helps lower heart risks in patients with both obesity and an autoimmune disease. A study published in the Journal of the American Heart Association found those patients who had a 17% lower risk of blood clots forming in the vein, as well as a 21% lower likelihood of an emergency department visit and a 44% decreased risk of death. Giving the RSV vaccine to pregnant women offers significant protection for infants in the first 3 months of life. University of Pittsburgh researchers found maternal vaccination reduces the risk by nearly 70% of both hospitalizations for respiratory illnesses and for more severe lung infections caused by RSV. June is Gun Violence Awareness Month. Back in 2020, firearm injuries became the leading cause of death for U.S. children and teens between the ages of 1 and 17. But there's a new push aimed at keeping kids safe from gunfire. In today's Health Minute, Mandy Gaither explains what the Agree to Agree campaign is about and why one doctor is on a mission to save lives.
As a trauma surgeon, Dr. Joseph Sakrin knows all too well the dangers of guns in the wrong hands.
I see it in the operating room. I see it in the families that I have to sit down and explain to them that their child that left that morning is never coming home again.
But Sakrin's heartbreak for his young victims runs deeper to the core of what he is now, a doctor determined to save lives. Because when Sakrin was 17 years old, someone saved his. A stray bullet struck his neck after a football game.
It allowed me to really, I think, appreciate not only the second chance that I was given, but the opportunity that I have to use my life to give other people that same second chance.
Sakrin says prevention is the best medical treatment for a gunshot wound. That's why he's joined forces with the Ad Council's Agree to Agree campaign, which aims to find nonpartisan common ground to answer one question: how do we stop gun injuries from being the #1 killer of kids?
The political noise is loud, but the common ground underneath it is real and wide. And this campaign is how we build on it.
The website has tips on how to talk to other parents about guns in the home, the warning signs of kids in crisis, how to secure firearms, and how to talk about preventing youth gun injuries in communities across the country.
The Ad Council's own research found that 80% of Americans in households with gun owners agree that safe storage would reduce gun violence. And when I think about that, that's not a fringe position. That's a supermajority.
For Health Minute, I'm Mandy Gaither.